In this presentation, we will talk about the coronary artery disease, its pathophysiology, and the signs and symptoms will be occur when the patient have this disease. And finally, we will talk about the risk factors and how can you prevent yourself from this disease. First of all, we need to define the heart. Heart is muscular organ, pump the blood to the other organs. Coronary artery extend on the surface of the heart, feeding the heart with oxygenated blood. Any plug in the coronary artery leading to heart not work properly. This disease called coronary artery disease. Coronary artery disease is the most prevalent type of cardiovascular disease in adults. In the 1990, 5.2 million deaths occur in the world from coronary artery disease, and this number is increased highly in 2015 to 7 million. So that's indications to the importance to talking about how can you prevent yourself from this disease. Symptoms and effects of coronary artery disease: shortness of breath, palpitation, which mean faster in heartbeats, dizziness or weakness, nausea, pain in left shoulder, arms, neck or jaw. For this disease, there is modifiable risk factors and non-modifiable risk factors. The modifiable risk factors which we can control it to reduce the risk for development of coronary artery disease, like smoking, high blood pressure, high cholesterol level, and diabetes, being overweight or obese, and the physical inactivity. Non-modifiable risk factors which we can change, like family history. If one person from your family have the coronary artery disease, it will increase the risk to you to have this disease. The second non-modifiable risk factors: age. If the person have 55 years or older, it will increase the risk to have the coronary artery disease. The last non-modifiable risk factors: women with history of preeclampsia. Now the big questions. How can you prevent yourself from the coronary artery disease? 1. Get active and have daily physical activity. 2. Control your cholesterol level, because increase in cholesterol level in blood lead to a plug in coronary artery. 3. Eat better. Eating food can decrease cholesterol level, like vegetables, fruits, and fish meats. 4. Manage your blood pressure within normal range, because high blood pressure is the major risk factor of coronary artery disease. 5. Lose weight. 6. Reduce your blood sugar. 7. Stop smoking. By know the risk factors of coronary artery disease and know how can you prevent yourself from coronary artery disease, lead to healthy heart and healthy life, and that's our goal from this project.